Now, Republican lawmakers are returning to Capitol Hill this week facing a health care crisis with Affordable Care Act subsidies having expired at the end of last year, December 31st, and no clear path forward for extending them. The GOP remains split over whether to extend the subsidies even at all. Without them, at least 20 million Americans are facing an increase in premiums this year if they get their insurance through the health care marketplace. Scott Darius is the executive director of Florida Voices for Health and is joining us via Zoom this morning as we dig more into this conversation that we know impacts so many of our viewers. Scott, good morning. Thanks for being with us.
Good morning. Thank you so much for having me.
Would you give us a thumbnail of what Americans, millions of Americans, quite frankly, are facing without an extension of these tax credits?
Yeah, and there are really two things happening at once. I think the first really impacts every American almost, anyone who gets their insurance through private insurance. There was this baseline increase in the rates for healthcare, right? So as your first premiums, everyone's first premiums came due the last couple of days, I think most people are feeling this increase in what they're paying for healthcare, this year. But for people specifically enrolled in the ACA, I think they're feeling this, the non-extension of the tax credits, meaning, and I do want to say that there are tax credits available. Maybe that's something we'll circle back to. There is still help available in the marketplace for people who are purchasing plans there. It's just that as you've seen this huge increase in the baseline rates, the enhanced premium tax credits have disappeared, meaning the amount of help people were getting before isn't there. And so people are having to absorb this huge increase that happened in just, the 1 year.
Can you give us a sense of Duval County residents, the number of them who have previously been able to take advantage of these credits that may now no longer have them available to them?
Yeah, just in Duval County, it was over 180,000 people who were enrolled in the ACA. And that's actually good for a sixth best in the state, right? The sixth highest enrollment. And then you look at even the surrounding counties where there are tens of thousands of people enrolled in the marketplace. And I'll say, one of the things that the state has done well, but I think also local to Duval, is just this decreasing the overall uninsured rate over the last few years. And I think the big fear is that if you have tens of thousands of more people become uninsured suddenly, what that means for, local resources and the safety net.
Yeah, and which impacts all of us, even those of us who have private insurance. So we know that 4 Republicans broke at the end of last year with their party and support more discussion about an extension. But time really is running out. I mean, what's that timeline looking like?
Right. It's already January 2026. So, the plans have been effectuated for those who signed up before December 15th. So really, we're already kind of past it. But there is the rest of the year, and there's still the cost that people are faced with, right? And right now, where we are in the timeline, Congress will return sometime this week. I believe Speaker Johnson has made a commitment to have a vote on the enhanced premium tax credits, and it's expected to pass. I think it'll go to the Senate from there, and we'll see what happens, right? There was some support for it, a majority of support, and we'll see if they can pick up a couple more votes, and ultimately, if it's something the president will sign. If it makes it to the finish line, I think there's any number of technical things to figure out, right? For those who have already signed up for plans, how to make sure that they have another opportunity to look at what their options are. How do we, maybe for those who sat out this time, for them to have another opportunity to look in the marketplace. I think there's any number of kind of technical issues to figure out, but it's doable, right? And so let's not end our pursuit of the help that people need just because it'll be a little bit difficult to figure out like the technical aspects of it on the other side.
Scott, you mentioned that there are tax credits available. Would you expound on that and explain for those of our viewers at home who are watching, they already know that it's going to cost them a lot more if they enroll and they're wondering whether or not they should even do it?
Yeah, so in 2021, when the ACA passed, I'll say back in 2010, it came with these tax credits, right? Premium tax credits for people earning between 100% and 400% of the federal poverty level. As we got through COVID and as costs continue to increase, in 2021, due to the federal legislation, there was this enhanced premium tax credits that were passed, meaning people got additional support to help cover the cost of premiums and healthcare. And now that those enhanced premium tax credits have expired, the plans, like we've talked about, have become much more expensive, but there still remains that baseline or that initial bit of help. That's always been around, the premium tax credits in the marketplace. And so, yeah, we're just encouraging people to make a list of their priorities. What are the things that are important to you in terms of providers or making sure that your prescriptions are covered? And then just getting back in the marketplace and seeing what your options are. You won't know until you take a look. And yeah, there are all sorts of changes you might have to make and sacrifices you might have to consider, but it's still worth engaging in the process and trying to get covered for 2026.
Scott Derry's Executive Director of Florida Voices for Health, joining us this morning. Scott, thank you for your time. We appreciate you.